guys, and welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Gastro, and today's video is a super interesting one. So let's get started. So in today's video, we'll be exploring the question, what are 10 signs you may have a UTI? So just to recap, a urinary tract infection, which is also commonly known as a UTI, is an infection of the urinary tract, which means that pathogenic organisms are infiltrating the urinary tract's urethra, bladder or ureters, and kidneys. So urinary tract infections, which are commonly known as UTIs, are the most common bacterial infection in the world. They account for nearly 25% of all infections occurring in women, and they result in 250 million infections annually worldwide, and nearly 10 million doctor visits each year. It is also said that 1 out of every 3 women will have to get antibiotic treatment for UTIs by the age of 24. So here are 10 signs you may have a UTI. Number 1 is burning or painful urination. So medically known as dysuria, the burning sensation and discomfort during urination is one of the key signs of having a UTI. Bacteria cause the urethra to become red and irritated, which in turn cause an itchy or stinging feeling as the urine passes out. Number 2 is urinary urgency. So urinary urgency is the overwhelming need to urinate and get to a bathroom as quickly as you can. This is usually attributed to the sudden pressure buildup within the bladder during a state of infection. Number 3 is urinary incontinence. So usually our urethral sphincter and bladder wall work well together to control the flow of urine. The bladder wall muscle squeezes to force urine out of the bladder, whilst the sphincter relaxes to allow urine to pass. But when there is an infection, the bladder muscles often contract at the wrong times, which can cause urine to slip out and leak at any time. Number 4 is the increased frequency of urination. So the byproducts of the infection will usually create inflammation and irritation in the linings of the urethra and bladder, which can end up sending very confusing signals to the brain. Most people on a normal day urinate between 4 to 8 times, depending on fluid intake, but patients with a UTI can go up to 20 times per day in some cases. Number 5 is blood in the urine. So medically known as hematuria, this actually occurs when bacteria infect the inner linings of the urinary tract, causing irritation and abrasion, which in turn lead to the red blood cells being leaked out into the urine. Number 6 is cloudy urine. So medically known as pyuria, this is when the urine appears to be cloudy or milky in color. The cloudy appearance is usually the result of excess white blood cells or pus in the urine. During the onset of infection, the immune system responds to bacteria by sending white blood cells there to fight them off. So these white blood cells actually congregate in the area to try and fight off the infection and end up being passed directly into the urine. Number 7 is urine that has a strong odor. So when there is an infection in the urinary tract, the urine may take on a very foul-smelling odor. The main cause of the smell is bacterial overgrowth. The presence of pus and or blood from the infection may also contribute to the strong and foul smell. Number 8 is pelvic pain. So pain in a UTI is generally felt below the belly button in the anterior lower abdominal region, and may include pain around the sex organs as well. The pain response is usually triggered due to local inflammation in the area. Number 9 is rectal pain or pressure. So rectal pain is often described as an achy or intense pressure in the rectal region in patients with a UTI. This pain may even spread to the back and often worsens if the bladder is full. And finally, number 10, which is fever and chills. So fever is the body's general way of dealing with an infection. The rise in body temperature is the body's way of trying to kill off any infection-causing germs. And chills are the shaking, shivering, and cold feeling that often comes along with having a high fever. And that brings us to the end of this video on 10 signs you may have a UTI. Thank you guys so much for watching. Hope you found the video very informative and interesting. Please make sure to like, comment, subscribe and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. Take care and bye for now.